Hey guys, it's Leah B from Prestige Veteran Medical Consulting. I'm a U.S. Army veteran, physician assistant, and former compensation and pension examiner. Today I want to come on and do a video about herpes simplex virus, or HSV, as it relates to PTSD and other mental health conditions in VA disability. So we've done several videos on PTSD in the past. We've also done videos on herpes simplex virus in the past in just a general way, but I'd like to do a video to talk about how they intersect, right? So herpes simplex virus 1 or 2, often referred to as HSV or herpes, is a very, very common condition, right? Especially type 1, which is traditionally the type that is found on the lips. That is super common. If anyone's ever really had a cold sore, you've probably been exposed to the virus. Type 2 is the type that is traditionally the type that's on the genitals, but over the years, they have sort of, you can have one on either location or both or whatever. So it's very common. A lot of veterans suffer from herpes simplex virus. Some people think it's sort of embarrassing, but it is what it is, and tons of people have it. So it's important that if you're suffering from it, that you seek help for this. You talk with your doctor about it. If you believe it's related to your service, and you want to consider filing for it, you can always talk to an accredited claims agent or an attorney or a BSO, and they may be able to assist you with that. So I always like to throw that disclaimer out that I am not a legal professional. I do not assist veterans with any type of legal filings, but I often work with legal professionals in my current capacity as a medical professional who writes medical opinions for VA disability cases. So moving all that aside, let's talk about how these conditions are related, right? So first, let's talk about the World Health Organization discusses the disease, herpes simplex virus, stating that HSV, known as herpes, is a common infection that can cause painful blisters and ulcers. It primarily spreads by skin-to-skin contact. It is treatable but not curable. It is a highly contagious infection endemic throughout the world. HSV infections are lifelong. HSV lives outside of the nerve cells and alternates between being inactive and active, and certain triggers can make the virus active, including illnesses or fever, sun exposure, if you're a woman, being on your menstrual period, injuries, surgeries, and emotional stress. So that's what we're going to talk about today, is that emotional stress piece. So the CDC, or the Center for Disease Control, I always like to give you guys some of my articles so that you can look them up, review them yourselves, maybe take them to your treating doctor and see if they want to assist you and support an opinion for your case. So the CDC, or the Center for Disease and Control, discusses HSV on their website, covering sexually transmitted diseases, entitled Genital Herpes CDC Detailed Fact Sheet. And they wrote that recurrent outbreaks of genital herpes are common, and many patients who recognize recurrences have prodromal symptoms, either localized pain or tingling, which occur hours to days before the outbreaks. There's no cure. Antiviral medications can, however, prevent or shorten outbreaks, like Valtrex, right? During the period of time the person takes the medication. You can also take suppressive therapy that can help with, some people take it every day to suppress outbreaks. So an article written in 2016 in Science Daily titled "Stress Wakes Up Sleeping Herpes Viruses, But How?" Reports a direct relationship between cellular stress responses, cell cycle regulation, and virus reactivation. It goes further about mutations of genes. And I won't bore you with all of the intricacies of that one, but you guys can definitely take a look at it. Again, Stress Wakes Up Sleeping Herpes Viruses, But How? In a 2016 article in Science Daily. Another article titled Persistent Stress as a Predictor of Genital Herpes Reoccurrence, published in the Archives of Internal Medicine in November 1999, is a good one to look over. It discusses, it's a prospective cohort study that followed up participants for 6 months using weekly assessments of stress and mood, monthly assessments of life-changing events, and diary reports of genital herpes recurrences confirmed by medical exams when feasible. It sampled a whole bunch of people, and the results were that persistent stress predicted reoccurrence in the subsequent weeks. And after adjusting for a recurrence in the previous week, the more weekly persistent stress reported, the greater likelihood of a recurrence the following week. Okay, so we talked about how they can be related and how stress can bring it on. Also, I think it might be interesting for you guys to watch my video that I previously made on HIV that talks about it being related to stress. These two disorders are completely different, right? But we talk in that video about how someone with stress or PTSD or depression or whatever can sometimes have riskier behaviors because of that stress. And sometimes that can be also tied to some of these sexually transmitted diseases, right? So I hope this video was helpful to you guys. Please drop some comments if you have any questions or comments about this, and I appreciate it. Please like and subscribe. And as always, thank you again for watching. All right, see you guys later.